Hi, I'm Dr. Colm Harney, dentolegal consultant at Dental Protection. Welcome to RiskBites, a series of podcasts created specifically for dental practitioners in Australia. RiskBites looks at the key dental legal risks and issues affecting dental practitioners across Australia and provides helpful advice and guidance on how to steer clear of them, leaving you free to provide safe and high-quality dental care for your patients. With new guidance being released in early September, it's timely to review some of the changes to advertising guidance, specifically those relating to the new guidance on the advertising of cosmetic dental procedures. Today we're going to discuss the key aspects of that guidance with one of Dental Protection's dental legal consultants, Dr. Simon Parsons, and try to tease out the important changes in store. Simon, welcome.
Thanks, Colm.
Now, I know you've been going through the pre-publication documentation around Ahpra's cosmetic dentistry advertising guidelines recently. If I was to ask you to summarise your thoughts about them in just a few sentences, what would that be, Simon?
That's a really good question, Colm. I can see that this is a response to the increasing uptake of cosmetic procedures by patients in the Australian population, the ongoing influence of social media, in the decisions that especially younger generations of patients are making about their oral care. And I think it's a very broad and not terribly prescriptive attempt to regulate advertising around those procedures.
Yeah, so that's interesting. And what makes you say that, Simon? Why do you think that?
Here we go. Well,
yes,
we're seeing an ongoing increase in the number of complaints and claims with our members relating to aligner-based orthodontics amongst general dentists. You and I know that we've got a lot of cases to do with veneers and how they've been proceeding, tooth whitening and complications that arise with those procedures. Sometimes there's been gum lifts and other surgical procedures thrown into the mix, and on certain occasions, Botox and fillers. People getting paresthesias, people getting all sorts of unintended consequences. So it seems that patients, especially those up to the age of 35 or maybe 40, are actively seeking these sorts of treatments to address either some real or maybe just perceived concerns about their own dental appearance.
Yep.
And on top of that, I think many of these procedures are being performed by equally young or often younger clinicians who are often quite inexperienced when it comes to the crunch and yet very eager to please those patients. So we've got this perfect storm. We've got patients who don't understand really what they're signing up for, and we've got clinicians who are signing up to do it on them who might not be aware of what they're really signing up for. And I think this is a measure to try to control at least the advertising around that, to try to ensure that there aren't sort of incentives being put in there through advertising to get these two parties to come together when perhaps they shouldn't. What really, when I said it wasn't really terribly prescriptive, I think the thing that's concerning me a bit is that these new guidelines don't really end up telling us exactly what we should say in our advertising. Nor do they really sort of provide us with an exhaustive list of which dental procedures fall under these guidelines. So I read it a few times, but like a lot of Ahpra's guidance, it seems as if it's left a bit open to interpretation, and it's left to the end user to work out, well, does this belong here or doesn't it? And I think it's really difficult to sometimes know whether a procedure that you might be doing on a patient, unless it's really specified here, is going to be subject to this guidance or whether it falls outside. So I'm a bit confused.
Okay. So let's park those ambiguous parts for a minute, maybe come back to those. Why don't we first talk about what maybe is clear and more easily or fully understood within the document?
Sure. Okay. Well, let's first acknowledge that there seems to be a really pure intent in these guidelines, and that's to protect patients, and that's a good thing. I think if we protect our patients, we're often protecting our clinicians as well, because if the patients don't get something done that they perhaps shouldn't be getting done anyway, then hopefully there won't be a complaint, there won't be an adverse outcome in many cases. So That keeps our practitioners, our colleagues, safe. I think the guidelines do a pretty good job in clearly articulating that these sorts of higher risk procedures are often sought by potentially vulnerable people, and I agree with that. I think that there's a cohort of patients out there who are attracted to do something cosmetic dentally, and they're often very vulnerable for a variety of reasons. And I think by these guidelines teasing that out, it raises our awareness of vulnerable groups who we treat. Mm-hmm. Often we see important health decisions being made by people, whether they're vulnerable or not, based on a pretty emotional basis, sometimes a highly emotional basis actually, and without a thorough understanding of the risks associated with the procedures that are being proposed, especially if they're irreversible procedures, then I think that leaves people open to a lot of disappointment. So I think the guidelines are good at raising awareness that we need to be more careful about who we advertise to and what the messaging is to those groups of people. I think you probably agree with me that a lot of our patients, even the ones that we think are quite well dentally aware, don't really understand that, say, if we are to do veneers on them, that if we cut a tooth, that's it. That tooth's never going to grow back. Mm-hmm. It's been cut once. It's been cut for good. We can cut it more, but we can't cut it less once it's been cut, and to some degree the same with any soft tissue, that if we were to trim that too. So a lot of the changes that we make, I would argue, are surgical procedures actually, because we're invading the tissues and they're a change for life. So I struggle a little bit, although I'll get back to this, with, this is meant to be largely sort of non-surgical, but a lot of what we do I think really is surgical. Mm-hmm. So I think that there's a bit of a confounder there as well. I think what it does latch onto in a way is to recognise that often patients basically don't really know what they like, but they know what they don't like.
Yes. Yeah, we see that in the complaints.
We do, don't we?
Yeah.
And I think that once we commit patients to a course of care, and that might be through advertising these options to them, that it might be something they actually don't like after all. But the images or the wording around those procedures had made it sound like something that they would like, only to be then really disappointed. And so given that it's really difficult to bail out of those sorts of situations once the patient's in, it's often with a lot of remorse that you and I deal with members who say, you know what, if I knew then what I know now, I would never have started this on this patient, and the patient has said the same thing. So the problem is they can't get them back to their pre-treatment condition without having caused some irreversible change. So I think if I was to summarise, I suppose, what is pretty clearly understood is that you've got to tread carefully with these patients, and you've got to tread carefully with the advertising that you are going to place before them. So I always say, because it was taught to me, that it's not up to me to provide financial advice to any patient. I'm not qualified to. And yet it sort of bothers me also that, a lot of our patients, not necessarily yours or mine, but out there, from what we see in our claims data now, are proceeding with cosmetic procedures that are being financed at considerable cost, and they're either being financed via buy now, pay later schemes because the patients can't afford the money up front, or it's being financed from the withdrawal of superannuation funds. Mm-hmm. And so what these guidelines do very well, I think, is to raise awareness that a lot of these procedures are potentially being funded or at risk of being funded that way. And I see that as being a real confounder in how these things go wrong, because we find that patients who succumb to this advertising and who then draw on funds that often they can't really afford to spend end up with a clinical result that they may not be delighted with. And $40,000 or $50,000, sometimes more of debt or lost opportunity. So, you and I have seen cases where someone who pulls out $40,000 out of their super fund at age 40 is probably diddling themselves out of $200,000 or more by the time they retire, because that money isn't going to grow now as part of their super. So, and they can get a tax liability to go with it. So, I think these advertising guidelines are actually good at saying, we've got to be wary that there's all this baggage tied in with this. If I was to be blunt, I'd say a lot of the patients who are most susceptible to the advertising guidelines have champagne tastes on beer budgets. And I'm not talking about Chandon and 150 lashes here. I'm talking about Verve versus some VB.
Mm-hmm. Yeah,
all right.
Yeah. So you're not a big VB fan.
I'm not. No, I'm not a big VB fan. I don't mind a 150 lashes, but yeah. So it's one of those things, isn't it?
Yeah, yeah, it is. And Simon, do you think? Well, I think you've laid it out that there is a risk. Do you think that the advertising of high-risk cosmetic procedures may induce or incentivize these sorts of people to consider treatment that they may not have previously considered to be suitable for them, leave them in debt, or may not meet their high expectations?
Yeah. I mean, I think that's, in one sense, the biggest risk here. I'm not sure always that these procedures cause harm, strictly speaking.
Yeah.
I think quite often Ahpra's remit is to protect the public from harm and to ensure safe clinical practice that way. Well, what I'm wondering about here is that a lot of these marketing claims that we see and the way that they're aimed is really to get us to consume goods or services that we wouldn't have otherwise even considered to purchase. Yeah. So it's to convince us of a real or perceived benefit in having those procedures performed.
Yeah.
And I guess when you look at the way the advertising is often pitched with the beautiful people with beautiful smiles and everything looks perfect about them, it is aimed at trying to convince us that we're going to have a happier life if we go and do this.
Yeah.
That life is going to be rosy. And I mean, that'd be nice if that actually does result. And maybe for some people it does, actually. I don't know. But I think really if I was to boil it all down, a lot of marketing is aimed at creating a want when it previously didn't exist in the first place. And we see that with soft toys coming out of China and various other places that people queue up to buy. There's a sense that there's a level of competition around all of this. I want to be better than the next person. So I think we attract people through advertising who are innately higher risk individuals. They often have high expectations, and you've got to be really careful because of social media and other channels where that communication is travelling, that we don't just create demand for something where it never existed before and then create a real problem for us individually and for the industry as a whole.
Yeah. And Simon, what specifically do you think is good about these guidelines in relation to this aspect of care, that more, I suppose, elective, patient-driven demand for care?
I think what's good about it is that it does identify in more detail those vulnerable groups. So the people with body dysmorphic disorder. I know that you and I talked about this in your podcast. It also identifies other groups such as Indigenous groups and others with social disadvantage. And it requires that the treating practitioners are appropriately qualified to perform these procedures, and so that way there is meant to be some control over misrepresenting one's ability to treat these people, as we know. We've talked about that already. It continues to outlaw the use of testimonials. That's a good thing, I believe.
Yeah.
Because we don't want people endorsing through their own experience. That's sort of a case study level of clinical evidence, really, but it's not a double-blind version. And just because it worked for them doesn't mean that it's going to work for you. And yet, testimonials and endorsements have always been aimed at trying to say, well, if this happened to me, therefore it's going to happen to you. You're going to have a great experience too. And that's not necessarily logically the case, is it? So, and we know that, anything that involves endorsements and so on is potentially fraught that way. It also extends to outlawing entering into any arrangements with social media ambassadors specifically, and those sort of social media influencers. Sorry, I'm getting old and cynical enough now that I don't think that's a proper job, but I probably shouldn't be saying that. But, I think those sorts of people have been used to try to, again, convince people to go ahead with something because, hey, this is, really good. But I don't think the evidence is always there that that's true, and we don't even know whether that person had any of those procedures done.
Yes.
Sometimes it's all fiction. And I was watching something on the news yesterday where they're using AI now to create beautiful images of people posing in all sorts of situations with, beautiful hair and bodies and teeth, but none of it is real. And these people have been used as social media influencers and they don't even exist.
Yes.
So when I say people, it's in inverted commas. So I think all of these intentions in the guidelines are actually really good in trying to be prescriptive in those areas, to say be really careful that you don't engage with people like this because it's the wrong thing to do. The other good move is, I think a really smart move, is to prohibit the targeting people under the age of 18 in any of the advertising that we use, and by that also stopping then underage people from being used in advertising. I interpreted it that way.
Yeah.
So I think it's really encouraging that they see people who are very young who ought not to be going through often irreversible cosmetic procedures to not be targeted with this advertising.
Yeah. Is this the first time you've seen Ahpra targeting advertising among specific age groups?
Well, it is for me, and I think it's raising a lot of awareness that way, that these people are very susceptible to being influenced by external forces. I know that other government departments or semi-government departments have done it in the past, such as banning advertising of, say, cigarette advertising using sports people, and trying to stop people of a young age from taking up habits that they know are bad for them. But we also know that you don't even need advertising to get young people to do things that aren't healthy for them. Just look at vapes.
Yeah, no, exactly.
And we see this, I know, but many young people obsess about minor blemishes or flaws in their physical appearance. And the last thing we really want to do is foster a society full of narcissistic, obsessive young people who might even grow into adults with even stronger views, because they're going to carry this with them potentially their whole life. So, again, I think the intent is pure. I think the intent is recognising a real problem out there in certain groups within our society who are going to be susceptible to advertising. So I can see a lot of good things here.
Yeah. And I agree. You've outlined a lot of valid concerns that I think the regulator are flagging up here. But many of our listeners might not be going to advertise these procedures, nor do many of them. So why should they really care about these changes, do you think?
It's a really good question, because I think it really boils down in my mind to what is or isn't included and being really clear about it. And that's where we come a bit unstuck. This is where I get a bit confused about how grey it is. Like, is it a surgical procedure or is it a non-surgical procedure?
Yeah.
I know that Dental Protection have been in touch with Ahpra to seek some guidance around interpreting this and getting some clarity. And my understanding, based on the information that I've seen, is that, say, if we're talking about orthodontics for teenagers, to use an example, because they're under 18. Now, if the primary purpose of that ortho is to improve the personal appearance of that person rather than the function, then if we were doing advertising, showing cases of young people who've had ortho, and not being very explicit of how that corrected primarily a functional problem rather than a cosmetic one, then I think that could probably be a breach under these guidelines. But how do you know the age of the patient whose images are being used in the advertising? And how do you always know what the primary motive for that care was in the first place? And even more of a problem, I haven't ever met a patient wanting to have orthodontics that doesn't want to have a better smile.
Yes.
And I don't blame them. I think, hey, that's why you do ortho, right?
Yeah.
You want to have a smile that dazzles people. If it can fix a whole lot of other functional problems, then hey, that's really good too. But so it becomes, I think, a bit difficult. How do we measure it? How do we know? And I think to answer your question, all practitioners need to understand the guidelines because they need to understand that some of the patients who they would treat, if they were going to use their images or any content related to the sort of procedures they're doing, or even if they're just offering these services, that it has to be targeted in such a way that it doesn't appeal to young people.
Yep.
And I don't know always how you can exclude young people from reading it, being incentivized. So, that's really challenging. They've said the same thing with YouTube this week, that under 16s, if I read the information correctly, will be denied having a YouTube account. But it doesn't stop under 16s watching YouTube. They just need to be signed in under someone else's name, And I think these guidelines are going to do much the same thing. Like they're going to try to get people to do advertising that is motivated by more pure motives, I think. But I don't know how tangible the impact will really be.
So I suppose the question that everybody will be running through their heads now, do you really think Ahpra will go after a practitioner who has this kind of material on their website?
We don't know, do we? Because we know that Ahpra, from time to time, if they receive a complaint specifically about a practitioner's advertising, and I think you've latched onto that in the conversation we've had before, have been known to approach practitioners and actually take them to task and get them to correct advertising that isn't consistent with the guidelines. And you and Kieran and the whole team encounter people who come unstuck because of advertising guidelines and lack of compliance. So I suspect that they will, but it's going to be one of these really grey areas. If they say that was targeting an under 18, well, how do you know? I don't always know. Like if they use lots of emojis and they use words or images that appeal to a very juvenile audience, I think that would be a clear-cut one.
Yeah.
To give Ahpra credit where credit's due, I've seen on multiple occasions Ahpra being understanding when there's been an inadvertent breach of advertising guidelines, and they've said this is what you need to do to comply. We want you to comply, and when the practitioner has complied, that's been the end of the matter, and the patients haven't been, I think, unfairly treated because of that advertising. There's been no harm. It's just been an inadvertent breach, and I'm hoping that will be the same here. But we've also seen Ahpra give people a hard time sometimes over something relatively minor.
Yeah.
So I think we're just going to have to wait and see how it all plays out.
Okay. And is there anything else that concerns you or that you think might seem quite ambiguous as well here?
There is, and it's something that we talked about in the other podcast, and in case you haven't listened to that, we recommend that you do. And it's just that the guidelines list higher risk procedures such as veneers and particularly injectables and fillers, PRP injections and the like. Now, not all of these procedures have a primarily cosmetic purpose, and that list is not exhaustive by any means, but it just lists things like veneers. But it doesn't talk about, say, full mouth rehabs that will achieve a functional and cosmetic improvement. I think Ahpra defend their position by saying that they're not going to be prescriptive because new technologies are coming into the market, and so if they prescribe what it is now, the guidelines may very quickly become redundant. But we have guidelines for everything else that get reviewed every 2 to 3 years. So I'm surprised in one sense that they haven't decided just to give us a list and then review that list in another 2 or 3 years. So what's I'm finding ambiguous is because I don't know with absolute clarity what is or isn't included.
Yeah.
And I don't understand fully why what I consider to be a surgical procedure is described as a non-surgical one.
Mm-hmm.
That I can't guide our members very clearly as to how to comply because it's not totally clear to me. I think we need some more transparency around this and maybe some sort of further examples to bring it to life for us. And hopefully that will come.
Okay. And I don't know if you think, is this a fair statement to say the average dentist should be fine if they're not incentivizing unnecessary or ill-directed treatment? What do you think of that?
I agree. I mean, I think, you know how we always think, well, the police aren't going to pull you over while you're driving if you haven't been drinking and if you're not speeding, if you're staying in your lane.
Yes.
I think if we stay in our lane and see what we do to our patients as being in their best interests and being clinically necessary, then we've got nothing to worry about, because I think there's no question that our motives for treating those patients are sound and the way we go about doing it could be sound. It's just how we advertise that. That might be our position.
Yeah.
That might be what we do. I'm probably going to sound a bit old-fashioned here again, but I guess I find stop laughing. I find it's a bit disappointing that we really need the guidelines at all. I would have hoped that in this day and age we'd understand that, there's susceptible people out there. We're much more attuned to groups within the public who are susceptible to a whole sorts of things. Do we really need guidelines to tell us how to treat our patients correctly that way for advertising? I don't know, but that's where we are.
Here we are.
Yeah.
In a practical day-to-day sense, then, Simon, how do you see this playing out for the dentist or OHT, hygienist, prosthesis out there working on the high street?
I can see that there's going to be a real need for us as registrants to review and vet all advertising with our names on it. And in one sense, that's not new, but given that we're talking about a much more sensitive area now, I think it's putting a lot more of the onus on us to check what it is that is going out there with our names attached or with the practice name attached, and really making sure that if we delegate the task of doing advertising to our staff to do on our behalf, that we are checking it before it goes out, because we are going to be held to account that way. But there's another side to it, which is that, a lot of the people who we talk to now, I think it's fair to say that most people work across multiple practices during the week.
Yep.
Unless they own the practice and it's their practice. But the vast majority of contractor dentists work at 2 or more locations throughout the week. So I think it's the way it plays out for those people is every practice that you go to, you've got to check the advertising.
Yes, you're responsible.
And how often do you look at the website for the practice that you work at? You might have looked at it when you applied for the job.
Yep.
You might look at it if you can tell whether you've got gaps in your appointment book. But do you read all the other tabs or links to
social media posts?
Exactly.
Or things like that.
I don't know if you do. I know I don't.
Yeah.
And so I think we're going to have to stay on top of it, because there's a lot of testimonials that could be uploaded that we aren't aware of that suddenly put ourselves in breach, which we didn't authorise, but hey, it's got our name on it. It's talking about our treatment, so we're going to be seen to be held to account for that. I think if you're starting to or contemplating starting to work at a practice, you really need to understand what their social media presence is like, and be sure that it's compliant. And if it's not, then you're probably going to have this difficult conversation with your potential new boss or practice owner to say, hey, I can't work here while this isn't right. So we need to get this reviewed and checked. Otherwise, this isn't the right practice for me. So I guess as we're seeing the rise of the cosmetic dental practice as well, we're going to see some of these boundaries being challenged at times. We already see it challenged, I think, at times. So that's going to be interesting. But for the average person out there who just minds their own business and just tries to do their dentistry well, I don't think it's too much to worry about. I think, though, for a practice owner, if you're a practice owner out there, you're going to have to ask yourself the questions of, does my advertising comply? Does it incentivize people to seek treatment that they don't need or can't afford?
Yeah.
And what would be my response if I was the consumer? So we've talked about this a little bit already in the podcast that you and I did earlier,
Yes.
which was, what does the consumer interpret to be the messaging with this advertising? Is it what I intended as the dentist, or is it actually something totally different that they've misunderstood? Is their advertising educative, or is it actually a bit manipulative? Because if it's the latter, that's going to be a problem. Is the wording and imagery being used emotive and suggestive, or is it factual and clinical? And fundamentally, what is the age of the patients being used in advertising and who are going to be attracted to your advertising platform, whatever that may be? If you're the practice owner and you can be clear about that and confident that it all complies, then I think you're going to be fine.
Yeah. Okay, Simon, thank you very much for a really comprehensive overview and those last few, I think, summarising statements that sum up the aspects of these guidelines that I think practitioners really need to look at. And if you require more information about the new guidelines, again, we've got links in the show notes and the descriptors below, or go to the Ahpra website. So thank you very much, Simon, for the podcast, and thank you all for listening. And we do hope that this podcast was helpful to you and look forward to sharing more guidance with you in the future. If you like dental protection podcasts and would like to hear more, please subscribe and leave a review.